So I was in Nepal to provide some support to an adolescent health program. I'm an adolescent health advisor for Save the Children. So the day the earthquake hit, we were actually in the process of hiking around Nepal's second largest lake. What I remember is walking by a small hut, like a one room house with a tin roof, and started to see the roof started to shake and make this popping noise. So I asked the guide, I said, "What's happening in that house?" And before he could answer, then the earth just started to shake really violently, and it kind of felt like it was rolling and shaking at the same time. It lasted about a minute. That was completely terrifying. We figured out it was an earthquake pretty quickly, and the three of us that were together just grabbed onto each other and we just held on for dear life. So, first of all, my life was spared, and I feel incredibly fortunate. But as we were driving in, the scene became sadder and sadder. So I have pictures that you'll see of people's homes destroyed, a lot of red brick buildings crumbled, but then either larger concrete structures tipping over. So everyone was sleeping outside because of the aftershocks. They didn't feel safe to go in their homes. They were really scared to go in their homes and to just not be with the people they loved. Those 2 days following the earthquake, I think there was really the sense of fear that I was feeling amongst not only our staff, but just the Nepali people in general. And myself, I slept outside for the following 3 nights that I was in Nepal. The immediate needs that Save the Children was seeing was clean water and food and shelter. The second night after the earthquake, it poured on us that night. And so if you weren't under a tarp, you were getting wet, and it was unseasonably cold. So for us and anyone who's a parent, you think about how hard this is, one, for a child to be out of routine, sleeping outside, but then in the cold and in the rain. I think one of the biggest challenges will be the psychosocial issues for children. Obviously, short-term, immediate stress for families and children, but the longer-term toll I think it might have. One other challenge will be continuing with education. So when I left Nepal, I knew schools were closed for about a week. And now I hear they're closed for about a month. Everyone's been asking how to help, and I think the message is clear: donate to an organization they trust, like Save the Children. This money right now will be used to get pre-positioned materials that we have in the region to affected families, so shelter kits and blankets and baby kits. It will also help get clean water to those who are in need. It will help start up the education programs and psychosocial programs that we're doing. And it also helps our health teams on the ground who are doing daily assessments of the health needs as well as communicable diseases that could break out at any time in these kind of situations. So these are the ways Save the Children will use the money, and I think donating is the best way the American public can help.